Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. As you no doubt know, February is American Heart Month, our annual reminder to focus on our heart health. Experts estimate that up to 80% of heart disease is preventable, yet it affects nearly half of all adults in the U.S. Joining us to explain this and other heart-related questions is Dr. Michael Ghalchi. Dr. Ghalchi, a board-certified cardiologist, is founder and medical director of Manhattan Cardiovascular Associates and a clinical instructor in the Department of Medicine at the NYU Grossman School of Medicine. Dr. Ghalchi will explain the various forms of heart disease, symptoms to watch for, and screenings that can detect issues early before they become serious. He'll also share some simple lifestyle changes you can make today that can support a healthier heart tomorrow. Welcome to Health is the Key, Dr. Ghalchi.
Thank you so much, Elizabeth. I'm excited to be here. Thank you so much.
So can we just tackle that first statistic that just blows everybody's mind? So heart organizations say heart disease is 80% preventable, but it still affects so many people in the U.S. Why is that still the truth?
Yeah, that's a great question. I think it has to do with a few different things. One has to do with the way we approach diagnostics and screening and our investment in understanding each person's risk factors and degree of disease before a complication happens. What I mean by that is that our system is really good once something bad happens to jump in and do something about it. It's not as good as taking the steps beforehand to really understand when someone is going from healthy to unhealthy before a complication happens. And that's where I think there's a lot of opportunity to really do kind of thoughtful diagnostics in such a way that we can understand whose risk is moving in the wrong direction so that then we can intervene before a complication happens.
Right, so catching it early, as you said.
Exactly.
So many factors influence heart health, but I think what a lot of people don't understand is how exactly some of these factors affect it. Like, why does smoking hurt the heart? Why does too much alcohol and lack of exercise? What exactly happens that the mechanics that harm the heart?
Sure. So there are some things related to some of the risk factors you described that can directly harm the heart. So, for example, alcohol at a certain point, if very high quantities, can directly damage the heart. But most of the risk factors you described kind of interact with each other in a slightly more complex way. So, for example, let's say someone is drinking too much alcohol, and it's not directly toxic to their heart, but it's forcing them to gain weight. And then that disrupts their sleep. And maybe they have sleep apnea, and maybe it's affecting their mood. And as a result, they're not making good choices about the foods that they eat. This is just one example about how some of these risk factors interact with each other. And actually, this is a nice segue back to the first question that you asked about the fact that cardiovascular disease is 80% preventable, but why do we have such a hard time with it? Is that very often I think people fall into the trap of thinking that they need to be perfect, that either their nutrition has to be absolutely perfect or it doesn't matter. Either they have to go to the gym and be in at the top of the board of their gym, or it's not going to work. And I think the reality is that even the smallest things can matter a lot, partly because of this compounding effect.
Right.
Because by really kind of improving things in smaller steps in one direction, it very often kind of helps other things, and before you know it, the person has improved dramatically.
Right.
And in this way, kind of we always advocate for just kind of a stepwise approach, and people do really, really great, and they ultimately end up doing things that they never thought that they could do.
And it's interesting how everything is layered. One thing affects the other. And as you said, it doesn't have to be perfection. If you make little changes here and there, it can make a difference. If you could also explain what exactly happens in a heart attack.
Many people think that a blockage in an artery, necessarily goes from 10% to 20%, 30, 40, 50, 60, until it gets to 100%. And that's ultimately what a heart attack is. If we have plaque in one of our arteries and that plaque becomes unstable, then the contents of that plaque get exposed to our bloodstream and then a clot forms. And a lot of this is happening behind the scenes silently, because let's say we have a 30% plaque and that plaque is unstable and it ruptures and it goes to 50%. There's no symptoms associated with that. So one of the things that I always talk about with my patients is about how we're striving for stability. At some point, it matters much less how much disease there is there, what that percentage of blockage is, and what matters much, much more is how stable that plaque is. And so in terms of kind of our understanding of people's risk and following it over time and making sure that things don't progress to the point where a complication happens, a lot of times what we're doing is we're investing in stability. And there's a lot of tools we have at our disposal to evaluate, are things stable or unstable, and then also figure out, okay, the parts that might be risk factors for why it's unstable, how do we address those that make sense for each person? And that often is a combination between medicines and lifestyle. Sometimes when things are in early stage, we might be able to get away with just lifestyle changes. And very often we have patients that say, I want to do everything I can to never need to be on a medicine. And so then we build a program along those lines. And then some people say, I want every single thing that modern medicine has to offer. And then we build a program along those lines. But in most cases, once someone has established heart disease, it's very often a combination of these two things.
And I want to ask what is probably an obvious question, but what exactly is plaque? What is that stuff that's in our arteries that builds up?
Sure. So plaque is buildup of predominantly cholesterol, but it has other things in it also. But most of the time when we think of plaque buildup, we're thinking of cholesterol buildup in our arteries.
Okay, and so that takes us back to some of the risk factors. So cholesterol, diabetes, overweight, smoking, high blood pressure, diet, blood sugar. All these things can combine to hurt the heart. So the heart is working harder to do its job, basically, right?
Yeah. So remember how we were saying that the heart and the arteries are part of one big system, and so a lot of those risk factors that you described are actually injuring our arteries. So for example, smoking and tobacco, inflammation, elevated blood sugar. All of these things are affecting the walls of our arteries and making the heart's job harder, and then also affecting the arteries that feed the heart itself. And so when we're talking about a heart attack, we're talking about the arteries that feed the heart itself getting blocked.
And now that we're understanding everything that goes into heart risks, what are some warning signs? You had mentioned earlier that the percentage buildup may happen without any symptoms. So what are the typical symptoms, and what are some symptoms that may not be so typical but you shouldn't ignore?
Sure. So that's a really important point. There's the symptoms of a heart attack that you read about in the textbook, but in reality, people can experience many, many different types of discomfort that can be related to a heart attack and heart health. And even sometimes some of the words that we use, I think, can be confusing because, for example, sometimes I'll ask patients if they've had chest pain, and they say no, but I've had a discomfort, or I felt something in my chest, but it's not there all of the time, and I think it's because maybe a lot of times we have this conception of what a heart attack should feel like, but the reality is that it can feel a lot of different ways, and in particular, in women, we know it doesn't really follow the playbook. Also in diabetics. So on the one hand, we don't want to be alarmist about symptoms, but on the other hand, we don't want to ignore signs and symptoms that should be evaluated. And so that can be things like a pressure, it can be things like trouble breathing, it can be lightheadedness, it can be sudden sweating. I would say that if it's something that is new or different, it's always better to be on the safe side.
And I've heard it in women. It can also be like a pain in the jaw.
Pain in the jaw,
yeah.
exactly. Yeah, that's a good one to remember.
What are some of the screenings that people at risk, or even just for your annual checkup, you should have looked at?
Sure. So I think anyone with any risk factors, so that can be high cholesterol, high blood sugar, inflammation, family history, high blood pressure. Right. I think inflammation is a really important one. Inflammation is one that is not commonly checked for. Things like sleep. I think now there's enough awareness around sleep apnea being a risk factor, but even not enough sleep, disrupted sleep. So all of these things should really be kind of looked at and thought about, and then if there are some risk factors, or family history, or even once we reach a certain age, and some of this unfortunately is not according to guidelines, but that's part of the problem. It hasn't worked its way into our healthcare system's overall approach to create these guidelines. And so then it's really up to each person and their doctor to then say, hey, I want to be proactive about understanding these things so that I can stay ahead of the curve.
Right.
So I would say that people that have any risk factors or reach a certain age, 40 is kind of a little bit arbitrary, but I think 40 is a good age to really start thinking about these things. We have different types of diagnostic tests, in terms of blood work, of imaging, to really build a profile of what is this person's risks, and then how do we control them.
Right. And if we could talk a little bit about, so if someone who goes for their annual checkup, what they can expect heart-wise, and then what someone who would come to your practice saying they really want a workup. If you could just tell us the difference between those two.
Sure. So I think most primary care doctors do a really fantastic job of looking at the major risk factors. So, high blood pressure, blood sugar, family history, high cholesterol, also obesity.
So when I go for my annual checkup, my doctor usually listens to my heart, listens to my lungs. When would a PCP refer me to a specialist?
It's ideally before something has gone wrong and a symptom has occurred, or there's a sign of a problem, and it could just be, one risk factor, two risk factors, and it very much depends on each patient, kind of what they're really looking for.
So when someone comes to you for a workup, can you just walk us through what someone could expect when they come to see you? Sure.
So we really get to understand someone's history. We obviously do a physical exam. We do an EKG. I would say the common tools that we have that we use very often are an echocardiogram that shows us the structure and function of one's heart. We do carotid ultrasound, which looks for any plaque in the carotid artery or thickening of the arterial walls. We do stress tests, including stress echocardiograms. We do cardiac monitors, which look for arrhythmias, and unfortunately, many types of arrhythmias are asymptomatic or minimally symptomatic. Coronary calcium scans, then blood work. And then on that blood work, we're looking at all kinds of different things that tell us something about one's risk. So the common ones there are obviously cholesterol, blood sugar. So we use hemoglobin A1C. We look at inflammation levels. Then we're looking at some other secondary factors through blood work. Also, things like vitamin D and thyroid function and things like that. And then on history, we're trying to look at how is this person's sleep and stress and all of these other things that are kind of hidden risk factors.
And then by using all that, you create a program. And do you follow patients for a certain amount of time?
Very often we'll repeat, blood work, let's say once a quarter. And then if there are diagnostics that need to be repeated, that would happen once a year. Then born out of this need to really help people in between those quarterly visits or those annual visits, we've developed a program called Apollo 360 Health. And this is our digital program. It's available entirely digitally through our app, so people don't ever have to necessarily come to our office. And what we do is we sync with wearable devices. So, the most common reason people enroll is high blood pressure. So we connect with people's blood pressure devices, and then we also connect with wearable devices, and then we assign each person a coach. And so in this way, we're looking at kind of what's happening with their sleep and what's happening with their blood pressures, and so it's not just a visit once a year or once a quarter. It's really kind of that time spent in between that we kind of help people manage.
They can check in with their coach digitally.
Yes.
That's great. So obviously we talk about treatment being a combination of sometimes medicine, usually lifestyle. So can we just talk a little bit about some lifestyle changes that people can make? And again, we emphasize here all the time, nothing has to be perfect. It's not all or nothing. And I think a lot of people do get discouraged if they're not doing things, quote unquote, perfectly. So if you could just talk a little bit about some of those things that people can start.
Sure. So, I love that idea that you presented of kind of quick wins. Just try to get some quick wins wherever possible. So nutrition wise, I think a quick win is to cut down on the amount of processed food. Very often people, once they say, I liked this other option just as much as that processed option. And it's just because I had never thought about it that I was just, having option A.
Yeah.
And now that it's just as easy to have option B. In terms of physical activity, people think that it has to be done in a fancy gym with fancy equipment. But I think that there's some really easy quick wins there that might just be, this sounds like a cliche, but kind of taking the stairs at work. It's just finding parts of your daily routine, and just by making a little tweak, you'll be getting a little more physical activity than you would have otherwise.
Right.
And not turning it into such a huge deal, but just kind of making it a part of your day.
I think a lot of people get scared off by the 150 minutes per week.
Right.
And it's like 150, I can't do 150.
Yeah.
But if you break it up into small things, and as you said, it sounds like a cliche, but we recommend like getting off the subway or the bus to stop early, just working little bits in, and it adds up throughout the day.
Exactly. And along those lines, also doing what people enjoy. I think a great example is gardening. Very often people that love gardening, they're going out, they're bending over, they're twisting, they're turning, they're walking, they're physically active, and it doesn't feel like, oh no, I got to go to the gym and go on the treadmill. It feels like, hey, I really enjoy gardening, and so I'm going to do some more gardening.
I think that's so important to focus on something that you love that you'll keep doing.
Exactly.
And I think a lot of people fall into a trap of feeling like failures if they don't do the treadmill for 30 minutes. Can you talk a little bit about healthy sleep routines? I know that you've spoken about sleep apnea, and I'm all too familiar with that, Frank. So how can you create a more healthful sleep environment?
I think there's so much untapped potential for us as kind of a community and a society to help improve our sleep, because it affects so much. Some of it falls into the category of more medical things. So if you have really severe sleep apnea, that probably requires an intervention like CPAP or an oral appliance. Very often, we'll do a sleep study and we'll find that people have just positional sleep apnea.
Huh.
And so in those cases, it could just be something as simple as a pillow. Beyond that, I think the quantity and quality of sleep obviously matters so much. And even there, I think unless there's a little bit of a focus on it, it's easy to just to chalk it up to I'm too busy to sleep, or I'm just a bad sleeper. But if you really make it a priority for a little while, I think people find that it really improves a lot of other areas of their life. It improves their stress levels and their energy levels. So I would say a quick win there is to really just kind of devote some focus on it for a week or two and see how it feels. And then there's a lot of other things beyond that have been shown to really help. Having a very similar, going to bed at a similar time and waking up at a similar time, not being overly stimulated before you go to bed.
Yeah. Actually, in our January episode, we talked with our Deputy Chief Medical Officer about screen time before bed and how we're all trying very hard to cut back on it, but it's hard in this environment and, this culture. This is what we do now. But
yeah, exactly.
But it doesn't hurt to try. So I wanted to talk a little bit about, I think it's overlooked, how our emotions and our mental health affect our heart. Can you just give us a little idea of how you can work your heart-healthy mindset?
Sure. Yeah, absolutely. I think things like depression and anxiety, they very much affect our heart health. The mechanism of that probably also has to do with some of these other things that we spoke about, sleep and physical activity and food choices and things like that. And this is another example of how all of these things are interconnected. And so I think very often by making a little bit of headway in one of these areas, it very often helps in others. And I think mood is a great example of that. Once people's mood improves, their sleep improves, and there's this cascade that ultimately improves their long-term heart health.
I think it's sort of undersold how exercise really can improve your mood. I know over the Christmas break, I actually went to the gym more than I have in the past year, and I feel great when I'm done. It doesn't result in a change in the scale or anything like that, but I just feel much better, and that builds. I think a big thing, too, is patience. People need to be patient. They can't expect quick fixes from this because it builds up over time.
Yeah, absolutely. I think also that's where kind of coaching is really helpful.
For sure, yeah.
Having someone to help guide you, but then also hold you accountable. I agree with what you said is the idea of it's not going to be a quick fix, but with the right support, you'll get there. And I think that's what coaching provides.
That's really encouraging to hear. Well, you've given us a lot to think about this American Heart Month, and we were very happy to have you here. Is there anything you'd like to leave with our members?
Sure. I think just be proactive about your heart health. Ask questions. Another is to follow things over time, because that way you'll be able to figure out what little tweaks you can make that make sense for you, and then you won't get stuck in this perfection trap, because you'll know that, okay, my LDL was this last quarter and I made this little change that I can live with, and now it's this, and now it's where I want to be. So make a change that makes sense for you, and then track what the result of that change was. I would say those are probably the two things that would help our listeners most in terms of improving their long-term heart health.
Well, that sounds great. We really appreciate your time and thank you for coming in.
Thank you so much for having me.
Tune in later this month to our February keynote to hear Dr. Ghalchi discuss the key health numbers you need to know to keep your heart strong so you can keep doing the things you love with the people you love. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.